if you do it right, once is enough. So the question I think most women ask is, how do I know if I'm having a heart attack? Well, the way you'll know is many women will actually experience what we call typical symptoms of a heart attack. And by that, I mean having crushing chest pain or tightness across your chest, or even a sensation like an elephant sitting on your chest. And 2/3 of women will experience those classic symptoms. And if you have those symptoms, don't doubt yourself. Call 911 and get yourself to the emergency room. But for other women, 1/3 of women actually will not have any chest pain at all. And it's important for you to recognize, despite that, you can still be having a heart attack. So those symptoms might be more vague. They might be more symptoms of shortness of breath, or just shoulder pain, jaw pain, neck pain, back pain. You might have a profound onset of fatigue. Somehow you'd know it's different than what was yesterday. You just can't do anything. And if you have those symptoms, particularly if you're at risk for heart disease, you should call 911 too. It's okay to call 911 and be wrong that you're not having a heart attack. The mistake is not calling 911 when you're having a heart attack and being diagnosed in a very timely fashion. Because think of it this way, time is heart muscle. The sooner you get treatment, the better your outcome will be. So you don't ever want to question it. The problem for women though often is the fact that as a woman, you often think about everyone else but yourself. Even I've had patients who have been having a heart attack and they first clean the house before they go to the emergency room. That's not what you do. You don't worry about the house, you call 911. Don't have a loved one drive you to the emergency room because they can't take care of you if something bad goes on in the car. So it really is important that you know, call 911. As a woman, the other issue is when you get to the emergency room, sometimes not every physician will recognize that women can have heart disease. And they may not even take your symptoms all that seriously, particularly if they're the quote-unquote atypical symptoms. So in those cases, you really need to be your own advocate. Tell them that you know heart disease is the #1 killer of women, that you know that 42.9 million women in the United States are living with heart disease. Tell them what your risk factors for heart disease are. If you have a strong family history of heart disease, mention that. Ask specifically, are you yourself having a heart attack right now? That will prompt any physician to actually make sure your heart is okay. If you have heart disease and are living with heart disease, it's important for you to also ask, are you on the right medication? Again, you have to be your own advocate. You have to know if they're giving you the life-saving medications, because the difference for women often is not getting the right medications. The other thing is, after a heart attack, sometimes women don't even get referred to something called cardiac rehabilitation. Ask if you need cardiac rehab, and if you do, make sure they refer you. Remember, the power is in you to ask the right questions, and I hope that I've provided that for you to go to your doctor or when you're in the emergency room to ask the right questions.